I like the music. Frying butter. Deep frying, it looks like a stick of butter. It's probably not the healthiest thing for you to be doing. Oh, I see. At the hospital. I like how the doctor at least chained up his bike in an unsterile way.
Okay.
Oh, man! What the heck? Surgery for your heart. One, you should be asleep on a ventilator so you don't feel anything. You do need to make an incision down the sternum if you're doing an open heart surgery, typically called a CABG, where you're using new blood vessels, usually harvest from your own body. Then you bypass where it's blocked. What? Come on, that's messed up. You're causing traumatic brain injury just to knock somebody out. That doesn't exist. Jeez Louise. What is he doing? Just shoving his arms and hands right in there.
Oh.
Okay. Of course he did. He doesn't have a heart. Ripping the ribs open. Okay, so you see some sharp edged ribs. You got to be careful not to hurt yourself and lacerate yourself on sharp bone. Okay, I like this. I like this. It's pumping. Okay. Okay. He still needs a heart. He just don't typically have organs just laying around in the refrigerator outside of an operating room. Hearts are typically fresh because you don't want the tissue to die. With that heart, you need to get it from somebody else, and it's couriered, typically on ice, and needs to be put back into somebody else's body fairly fast so then you can get blood flow and repump. I think that's a little bit of a biohazard problem. What is that? Did you go to the butcher? Oh my gosh. It looks like he must have went to the butcher. He got his meat nicely wrapped. And of course, we got a heart that's on a sandwich that he already took a bite out of. Forget it. It's already gone hard. I'm just going to continue to eat it. People actually do eat organs. So most of the steaks that we eat is muscle. A heart is actually a muscle. You do have to be careful eating too much of an organ. Our bodies typically can't necessarily handle it so intensely. Small pieces of it you can. What is this? Trash out here. All right. It doesn't even make sense. It doesn't even make sense. I love how the doctor's like super proud. If you have these big massive hearts, you typically don't want to transplant them because they don't function as well. Too big of a heart, too strong of a heart actually doesn't squeeze the blood out as well. Okay, all right. So we got a blind doctor. With a big syringe. Yeah, I don't think anybody wants a doctor that can't see 100% to try to come at you with a needle. Oh, get another try. Oh, don't do that. Don't do that. Oh, what? This is like torture. Don't just keep jabbing, stabbing somebody, right? It needs to be sterilized. And you never actually go in like this. It's a delicate procedure. You go at a very shallow angle because the veins are just underneath the skin. Oh, it's still happening. It's just... and it's bending and breaking. What? There's no way that you can change direction when you're in there. The needle's gonna snap. And now you have a snap needle inside the body. To be able to get those out if it's embedded, you need what's called fluoroscopy, which is a continuous x-ray an interventional radiologist or a surgeon will use to try to find the needle to get it out. Oh, be careful with this axe. Oh no! Oh! Whoa. How'd that not get him? Oh, the foot. With this type of injury, you got to be careful or worry, so to speak, for one, it's a dirty wound now, so open fracture, laceration. And then the problem is, can he actually get out of this situation? Okay. All right. That stinks. That was a good idea to think about using the axe to break the piece of wood. But then wouldn't you think that if you broke that piece of wood that the tree's now going to collapse on top of you anyway? Okay. All right, what's in the pocket? Oh, I told you! Ah! This is... Oh my gosh, I can't imagine the pain. Oh my gosh. Okay, it's a cartoon, but think about this in real life. So you're using a spoon to cut through your leg. Like, that takes a lot of force. Now you have all the tissue is gone in the area. Now you only have bone. And obviously the spoon is not working. So he's getting to a rock to see if he can break it. Oh, that's not gonna work. Just smash it with the rock. Oh, it's split down the middle. Oh my gosh. Splintered the bone with the spoon. Can this actually happen? I think you'd actually have a better chance of just actually smashing it with a rock potentially, or me causing a little bit of damage with the spoon to cause a break in the bone itself to then be able to snap it open. Let's go. I hope he did the right leg. And he chopped off his wrong leg. All right, got the EKG going. Got some infusion. Looks like these are blood infusions. Oh! Darn it. Actually, in real life, it needs to be verified by 2 people before giving it, as well as making sure it's the right person, making sure it's the right blood type. That way you don't have errors. We need to double check ourselves. And obviously, you need to take a lot more care in trying to what we call spike the bag, so you just don't waste blood like that. Oh, okay. Went into like VTAC real quick, maybe VFib, and now is in asystole. Immediately when somebody goes into asystole, the monitor goes flatline. The first thing you do is check the patient. So you want to check to see, is it an error in the machine? So did a cord come off? Is the machine broken? Is the patient actually still talking and alive? If not, immediately call for help, start CPR. Creature didn't do that and looks like just stabbing emergently into their own arm. Let's see what happens. Ah, there we go. Woohoo! I love it. Now, the creature here decided to stab their own vein in hopes of siphoning their blood directly into the person. We see this in TV shows, movies, cartoons, all different things. I've never seen this in my practice of medicine in the hospital. But I've actually never been in the field in the sense of like warfare. You can't just give somebody your blood unless you're compatible. This could work in very rare situations. I've just never seen this occur. Oh, geez. Oh, I hate when that happens. What the? Oh! What? If that actually does happen, right, the major blood vessel that's coming down is your aorta in the abdomen. And if that just gets opened up, you can't stop it from bleeding. You're just going to bleed out in a couple of seconds and you're going to die. Then, of course, you have your spinal cord that's severed. The bottom half of your body is gone. No, wait a minute. Nice. That's so disturbing. Holy cow. Okay, this is disturbing as you could get. It looks like a piece of ham. Could this be survivable? I guess if you're able to stop the bleeding, you're able to survive a little bit longer, obviously. But then the question is, what organs are injured and is it compatible with life? I'm assuming he's blind too, so he doesn't always, I don't understand. Is he blind or driving blind? Oh. How many times has somebody done that? Just leaking out. Now you got a trail of blood. You have a trail of fire. Oh my gosh, come on. It doesn't work that way. Impaled into the abdomen, come on. There would be a lot more fire extinguisher injuries than you've ever heard of, but typically you don't, and it's spraying a powdered mist that's a fire retardant to get it to stop. Oh, and the car explodes. That's messed up. You see the explosion, it takes apart the abdomen, and now you have intestines that are just rolling around. And so the intestines look like this like tube, but it's attached by all this mesentery. So it actually is still in a big formed ball when it's in your abdomen. It kind of comes out like a little bit of a fan versus just these like strings. Oh. Oh. That's just mean. What the heck is that? You don't do it with a full cup of hot coffee. Now the animal has like either a first, second, third, or even fourth degree burn. So we don't know what degree of burn. So first degree burn, it's like a sunburn. It's just a superficial layer turns red. Second degree burn, there's two different types. There's a superficial versus deep, but that's when you get the blistering. Then you have third degree burn, which basically burns through the capillaries and the nerves, which will then end up meaning a skin graft. And then if it's fourth degree burn, it's going all the way down into the subcutaneous tissue, fat, and muscles. Pretty bad situation. Oh. Oh. Oh, nice. Oh, man, bleeding out of the ears. So you can have a rupture of your TM, or your tympanic membrane, or what we call the eardrum. You might not have good hearing as well after. Sometimes you can have a perforated eardrum and it's fine and it heals up well on its own. Other times you need a tympanoplasty, where you actually get a new eardrum from yourself, actually. You can use a piece of fascia and they put it right on there. Oh my gosh. Oh, come on. When you're using the otoscope, it shines light into the ear canal, the external auditory ear canal, so that way you can see the tympanic membrane and see if the canal is swollen. That's pretty much all you're going to see. You want to make sure that there's something called the cone of light, which is a reflection of light off the tympanic membrane to make sure it's intact. Oh, tuning forks. Nice. All right, I could hear. When I was in medical school and in training, we used tuning forks. We don't typically use them too much anymore, but the point of a tuning fork is to hear if there's bone conduction loss versus neurosensory loss, having to do with you tap it, you hear the noise, and then you can actually put it on the bone to see if you're having conduction. Ah, you can hear better. Nice. It has just a larger diameter so you can take in more of the noise, so you can pretty much try to amplify it. Now you have hearing aids that can amplify your noise, and then even then, some people who have no hearing, you can get cochlear implants. If you've ever seen somebody with like an electronic device attached to their head, and they can help them hear. I love this candy squirrel. Oh. 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 Oh, man. I thought it was a broken tooth, but it is a fractured jaw. That's crazy. Typically, the only times I see a fractured jaw is trauma from like getting punched in the face or car accidents. And usually you're broken in two places because the energy goes in one place and it needs to go out the other. And sometimes, of course, you get dental injuries as well. Or sometimes we get avulsions where the tooth is gone. Remember, if your tooth falls out and it's an adult tooth, two things that you can do is either put it in a glass of milk or just put it back in your own mouth. And typically we can just shove it right back in there, and then we'll do a dental splint and then get you off to the dentist to make sure that it stays more permanently. Ooh. Oh, yeah. Pliers. Woo. Yep. So why the heck do we wire a mouth shut? It's like a splint or a cast for a broken bone. You want it to set in one spot and not be able to move it in different directions. And then they actually give you a set of pliers so you can actually break through it if you get sick or you need to vomit, because you won't be able to get the vomit out. Oh, people hate it. Yeah, look at trying to use a screwdriver to open. Oh my gosh. This squirrel has a horrible sugar addiction. So sugar is a type of carbohydrate, right? Simple carbohydrate. And our bodies crave it. So if you have it, you're never satisfied. You always want more and you want more and you want more. Oh, oh no! A tongue laceration. Actually, amputation. Holy cow. If you have an injury to your tongue where it's bleeding, it bleeds so much, profusely, hard to control the bleeding, and it's just like all coming out. Yep. It's like a helmet. Oh my gosh. With a lock. That's horrible. I've never seen one of these. We have this thing called the halo, which gets screwed into the skull for somebody who has a cervical fracture. I've never seen this device for a jaw fracture. Oh. What the? It happens. Oh my gosh. What the? Your eye has multiple muscles and then it's connected in the back by your optic nerve. So it's probably the optic nerve that we see hanging out here. But the skin is gone. You don't see any of that. The nose is gone. Holy cow. What is going on? The intestines are very stretchy, right? So the intestines are actually made of muscle and muscle stretches. So it wouldn't rip typically. It could at some point, it's going to rip with enough force. It also potentially wouldn't necessarily strangle you per se because it's so stretchy. But if you have enough force, it's going to do that. This is ridiculous and scary. Oh my gosh. Hiding inside the sleeping bag and now threw it in the fire. This is a horrible scene. Normally the steering wheel would not do that. It would typically actually could bend. A lot of times people will get spidering of the windshield if their head hits the windshield. What the? Bottom half of his body falls off, rips out. That doesn't happen. But the anatomy looks so good. What we see hanging at the end of the clip is the stomach. That's the shape of the stomach. And it's most likely attached to the esophagus still. The esophagus attaches to your stomach. And then from the stomach, it attaches to your small intestine. Basically, the first part of your small intestines is your duodenum. Okay, we all know this is not realistic. But could you actually survive your duodenum being separated from your stomach? Yes, if you have a surgeon that can put it back together. Depending on the accident, a trauma surgeon would need to see versus a general surgeon versus both being in there. Typically a trauma surgeon is also a general surgeon as well. So this is my second iteration of Happy Tree Friends. Now it is really quite disturbing cartoon, but from an anatomy standpoint and from a doctor standpoint, it's actually quite entertaining to watch as long as you understand what you're getting yourself into. Uh-oh. Broken jaw on the toilet. Oh, drowning? Oh, that is crazy. What a horrible way to go. Could that actually happen? I mean, if there's enough force and then the impaled object is sharp enough to penetrate the tissue, yeah, that could happen. Now, the question is, to all of you, do you pull it out or do you leave it in? Leave it in. Get to the hospital ASAP if the person is still alive. Mr. Pickle did it. Oh my gosh. This happens in real life, call them open globes. Sometimes we can tell right away, it's obvious. Sometimes you can't. And you actually put a little stain in the eye called fluorescein. You see it kind of streaking out, which means that the aqueous fluids of the eye are actually coming out, just depending how deep it is. Oh, I don't think a card can cut the head in half though. Come on, that's crazy. This show is brutal. Oh, vacuuming up an olive and the pickle. And that was stuck, obviously. Right in the face. What's gonna happen? Oh! Yes! It doesn't even make any sense. What? Does the eye come out of the socket that easy? No. Okay, it's attached by the nerve and then 6 muscles and then you have different ligaments. For us to even get the eye to come out in an emergency, we have to cut the ligaments on the side that are keeping it in. He's a magician and he needs an assistant. He's gonna cut him in half. Zoop. Oh, he did. Who saw that coming? I saw that coming. Knowing these guys. You got intestine that is depicted by the strings. And then you can see some ribs under there. Oh. At least they called the ambulance if you're going to the hospital. Yeah, the patient's flatlined. Oh, back alive. Nice. If somebody's flatlined, they're not just gonna have them in the back of an ambulance doing nothing. If somebody's flatlined, that's asystole. No electrical activity, you need to be doing CPR. Asystole is not shockable. Standard protocols is epinephrine, chest compressions, epinephrine, chest compressions. The heart is not beating, so you gotta do anything you can to get the heart restarted. Oh, of course. What the heck? Ride those intestines. That is horrible. What the heck is going on here? Come on. Oh my gosh. They finally made it to the hospital. Intestines are, what do we say, 20 feet long? But the intestines are attached by a mesentery. It doesn't just come out in like a nice long string. They are kind of stretchy. And why are they stretchy? It's because they're a muscle. We have skeletal muscle, which is the muscles that we have for like lifting weights and looking good. Then we have smooth muscle, which is blood vessels, organs, intestines. Oh, I hate when that happens. Oh. A lollipop to the eye. Oh, there goes the eye. I wonder if you can still see. Oh my gosh. Don't panic. Most eye injuries are penetrating eye injuries, lacerations, not eyeballs coming out and having this conundrum of an issue to where it's wrapped around the tree. It could be depicting the optic nerve. It has to do with our vision, connecting our eye to our brain, and so you don't want to mess that up. Definitely not sterile anymore. If you only have one eye, you actually don't have the ability to have depth perception. The other issue is if you have any brain lesions, sometimes we'll actually have double vision, two objects over top of each other, one that's moving away or you just can't see, or specific areas of the field of vision that you can't see. So sometimes people can't see on both sides or in the middle. It all has to do with where on the optic nerve injuries occur and if it's also on the optic chiasm, deep within the brain. Oh, there's a bird. Get a peck at it. Goodbye, eyeball. Yep. Oh, no. Oh, there it is. Oh, wow. Eye itself coming out the other side. Very funny depiction. You have the brain that's coming out as a whole. You get the eye pulled out and you're pulling the nerve all the way that goes all the way to the back of the brain. It'd probably be more stretchy. As I said, the nerves of our body actually look closer to like polio string cheese. Very white, stringy. It's really interesting that the information that we receive in our body gets transmitted in these types of tissues. Oh no, he's all cranked out on his brain on sugar, and now he thinks, not doing anything at the moment because they're not connected to anything. But what the heck just happened? Oh my gosh. I see teeth. I see both kidneys hanging down. I see a heart. Most people have two kidneys. Sometimes people can be born with one solid kidney. Sometimes there's something called a horseshoe kidney where they're actually still connected. Oh, there goes a bucket of nails. Oh. There's always a risk that you're going to get an infection because the skin itself has bacteria on it. So when you get cuts and punctures, it potentially can seed it deeper. So you can get further infection treated with simple antibiotics. Plus or minus a tetanus shot. These rusty old nails. Nobody gets tetanus anymore because everybody gets the tetanus vaccine. Oh, it's gotta hurt. That's way too much force. Oh my gosh. It's gotta hurt. Leave it in or pull it out. This one is not a large impaled object. It's typically going into the soft tissue. So there's the potential likelihood that you can pull them out yourself. And then if you do find that it hits a major blood vessel or not in that area, one piece of small gauze, direct pressure right to the area that's causing the bleeding. Hold it for 10 to 15 minutes and the bleeding will potentially stop. If the impaled small object is not coming out easily, do not try to force it out because it could be stuck on something. You can cause more damage. What? Putting it back in, trying to hide him? Oh, that's not good. Oh my gosh. Yeah. Don't do that to a human being. There are times when, like, I've taken staples out of people where the angles are all weird from walking on it and stepping on it, and you just have to figure out the angle to get it out, and it'll come right out. Oh, I love going to the movie theaters eating candy. Uh-oh. Flashbacks. He's back! No! Oh! What the? In terms of being stuck in a seat, could you actually like tear somebody apart? Unlikely. You have a lot of different connective tissue. Unless there's an open area where there's already like ripped tissue, could you potentially grab it and rip it more? Yes. I've had to put a lot of joints back together. It takes a lot of force. Oh my gosh! When you're basically cooking somebody's head, you're probably gonna have a hole in the front or wherever you're putting the flame to that's got 1st degree, 2nd degree, 3rd degree. It's gonna be 4th degree burn, probably burning all the underlying tissue, muscle, bone, nerves, all of that stuff. In real life, the brain is a lot more like uniform, but it has those funky gyri, which are those swiggles on the brain. It has this like fleshy kind of color, and it's very, very soft. Could it actually heat up and pop like that? Obviously not. Whoa! When you're strangulating somebody, 2 different mechanisms are going on. One, you're decreasing blood flow to the brain, so that's going to make you pass out and decrease oxygen to the brain. And there's a potential of cutting off somebody's airway and causing all these other kind of further down the road processes. But typically when you actually knock somebody out, it's due to those combination of those 2 things. Oh, man! What the? The fact that the eye was actually still moving. In real life, if you die, could your eyeball still move a little bit? Potentially, yes, but only for a very short period of time. That's one of the things that we check for, having to do with if somebody's alive, is pupillary reflex and seeing if anything moves. Of course, that's not a good idea. Oh! Wait a minute. Literally, people come to the emergency department after falling on a treadmill, but most of the time the injuries typically are burns from the belt of the treadmill. Can you actually decapitate yourself from having weights fall on you? Well, there's something called internal decapitation, a severing or an injury of your spinal cord connecting to your brain. It severs in a way that there's no outward injury, so to speak. Are you going to tear open the tissue? It'll take a lot of force, a really high rate of speed, which typically doesn't happen when you just have an object falling from roughly 2 feet, potentially. Oh my gosh. Oh my gosh. Concrete to the face. We see injuries like this where somebody's taking maybe a brick to the face, causes fractures, lacerations, lose your teeth. You see the amount of blood that was pooling in the posterior pharynx in the back, maybe traumatic brain injury, because you potentially would die from injuries to the brain, occluding of your airway. There must be major vessels that were just destroyed and maybe bleeding out, and now you can hear the gurgling. So still alive, but not for long. Oh my gosh. What's happening? Oh man, so the moose looks like he's in a halo where the screws of the apparatus are in the skull, front most of the time and 2 in the back, to prevent your neck from turning, as now we just ripped his head to the side to the right to turn him. Shouldn't be able to do that, and we hear nasty crunching, which is awful. Oh, what? Oh man. Oh, burning off all the tissue. Oh. Just ripped out his whole arms. Come on. The amount of destruction that occurs in these episodes is unreal. He's trying to stop the wheelchair by gripping it as hard as he can. Really smart idea, because you're causing yourself injury to your hands. Grab on tight as best you can, but then his arms just rip out of socket. It's hard to do without some integrity that's missing to be able to rip through that. This other character goes flying through the air and gets sliced in half. Everybody's dead. Gotta shoot your eye out. Oh, man. I haven't seen a marshmallow injury to the eye, but I have seen some quirky, wacky things where people accidentally put crazy glue in their eyes thinking it was eye drops. And now they crazy glued their eyes shut. But if you did get a burning marshmallow to the eye, please immediately go to the closest ER. The eye is such an important organ in our bodies. The integrity of just the tissue on the outside, and you're burning it, it should be washed out immediately. But there are always caveats, especially if you're getting objects that are impaling the eye, then you don't want to touch it, just want to leave it alone. When in doubt, get to the hospital ASAP. Oh! And now you got the blind guy just getting pegged with all these. What? The eyeballs are just made of a couple cell layers thick. It's mostly fluid. So once the integrity has been opened, fluid's going to come out. It's going to be more deflated looking versus a perfect cylindrical eye. Oh, it's like a slingshot. It reminds me of Indiana Jones when that big boulder is rolling down, and it's almost gonna crush it. We don't get so many people run over by large boulders and being crushed that way. At home, you guys gotta be really careful with things that are on shelves or high up. We get a lot of people every age, they're trying to move something, don't realize that it's loose, and then it falls on them, knocks them out. Potentially whiplash injuries, skull fractures, bleeding in the brain, a lot of musculoskeletal injuries as well. Roller coasters, not for me. Whoa, they don't look attached. Putting it together like Legos, I guess. Oh, man! Awesome, I think. The individual who has heart out can actually notice it before they die. You still have enough blood flow in the body to have your brain function. Yep, that's pretty good. Oh my gosh, somebody's playing ring toss with his heart. Oh! Oh my gosh! You have to be super careful with pieces of wood that still have old nails on them. People step on them and they go through the soles of your shoe, and so you can puncture your foot. One, the rusty nail, you always worry about tetanus, so we always ask to make sure your tetanus shot is up to date. People have gotten nail gun shots in the head and survived no problem. Just depends where in the brain these injuries occur, and hopefully these nails are more superficial. Hopefully this is not a long nail, which then nails the soft tissue of your brain. Is he split in half? Oh my gosh. Let's look at the anatomy, people. Okay, we got the brain. We're missing some bones. I mean, it's not equated to a human, but the legs, we got a femur, we got the tibia. And then the eyeballs almost look like lemons, right? Blood oranges. Wow. Most of the time on roller coasters, the worst thing that people get, either they get nauseous and they vomit, or they pass out because of the G-forces. Whiplash, head injuries, if you're going side to side and you don't realize, unfortunately get somebody else's excrements, vomit or spit in your own face if you're behind them or something like that. Donuts, I love donuts. Oh, that's gonna be hot. Oh, it's stuck. Do you guys know what the universal sign for choking is? Universal sign. So if anybody's doing this around you, if the person confirms that they're choking, Heimlich maneuver. Taking the fist, reach behind them, thrust, squeeze into you to try to force it out. Oh no. Oh! Oh my gosh! You could have a knife puncture through your hand and miss everything except the soft tissue. So you can potentially miss all the major blood vessels and nerves and walk away with just some stitches, maybe some antibiotics. Or on the flip side, you can lacerate straight through the bone, hit major arteries, then you may end up getting osteomyelitis of the bone if it gets infected. There is the easy pathway or the really bad one. Oh no, what's happening? Oh! Oh man! The issue ends up being, if you have an oil burn, get the oil off of you so it stops burning. So you can use ice to cool it down, but it's more just to numb it for yourself. So treating second degree burn, first management unfortunately is pain management, and then if it's a deep second degree burn, it may need actually a skin graft. Yep. We got pieces of mousse in the donuts. It's disgusting. Oh no, oh no. Oh, it's out. Oh, what? Oh my. Look, you see like piece of the eye, you got the blood vessels, beautiful. Really impressive. I mean, I'm sorry, facial trauma. So depending on where you're actually injured in the frontal brain, you can actually be okay. A lot of times people will have brain tumors in the frontal lobe that you don't actually realize because you're just not aware of maybe a little bit of personality change. Once you open up the skull and you take that mass out, typically it's concealed into itself. So people actually do pretty well. Oh no, oh no. Strangulated him and let him, oh my gosh, that's horrible. People do stupid videos where they jump into a ceiling fan and break it. You can really cause major injuries, lacerate yourself, fractures. Like, not worth it to do these stupid things that might look cool in front of other people. Almost look like an apple core. In medicine, we actually have that when there's a CT scan image where the colon has an apple core deformity, and typically it's related to colon cancer. They have trouble going to the bathroom because the tumor starts growing into the colon itself. Oh, never a good blender issue. No. Do not stick your hand in a blender when it's still plugged in, because it's going to release. And shoop, there goes their finger. No, wow. Smart. Oh, good. Unplugged it. Wonderful. Oh my God, it's going to choke on it. Allergic reaction, allergic reaction. Knives are actually developed because of histamine. That's why you take an antihistamine like Benadryl. Your mast cells are getting degraded and release the histamine, besides the inflammatory response that you're getting as well from an allergic reaction. Oh my. We get patients that come in, their tongues are swollen, they're coming out of their face. Sometimes it's safer to say, okay, we're gonna put you to sleep, put a breathing tube in, that way you can swell around it, but your airway is protected. And then once the reaction stops, we'll take the tube out and you'll be okay. Uh-oh. At this point, you're not going to do well with Benadryl. You need to get an EpiPen in the deltoid, in the thigh, in the buttocks. Go through clothes. Hit it hard, hit it fast. Okay, good. At least the ambulance got there. And we look back to normal. Good. No. Some people are even allergic to the dust of peanuts or anything that might have actually touched it or the oils of it. So you have to be super careful. Nowadays, though, you can do microdosing so your body changes the way that it reacts. What's the matter? His tail is... Oh, he can't get his jacket up. Okay. Oh, man! Ouch. The first thing I think about is something about Mary. We got a bleeder! What do? You get this off. You kind of rip this apart if you can, versus like, do you reverse the tracks? Ouch. Oh. This is so messed up. I'm so confused. Why are organs going on the backside? Wow. Seagulls are aggressive. Be careful. My wife was at the beach one day. She turns her head for a second. Seagull comes down and steals half of her sandwich. All right, surf it. What the? Okay, this is gruesome. I live in Southern California. A lot of people surf out here. A lot of times you actually see vertebral fractures, so back fractures, because people will get thrashed by the wave and then boom, they have back injuries. What? Be careful of falling coconuts. It's not that bloody in the brain like that. The brain itself is more gelatinous, gray matter, white matter, soft, gooey tissue. There was a movie back in the day with all crows and they're just killing people. That's all I can think about with these darn seagulls. Oh! I've seen chainsaw injuries. You have to be wary of where you're actually putting it. A lot of times people will bring it up and actually hit themselves, hit their shoulder, hit their head. It could actually get caught and pull. What? Usually when somebody has a sense that's off, your other senses kind of become more hyper aware. When you can't hear anything, you can potentially have a hypersensitivity to touch, so you can actually feel the vibrations. Okay, playing doctor. We got dentist. Okay. Oh, we got a rotten tooth. Oh. Who likes going to the dentist? They're using those weapons of destruction. Just kidding. They're using their scaling tools to feel the densities of the tooth itself. Oh gosh. Oh gosh. Oh god. Breathe, bro. Breathe. Oh! trying to inject in the side. You can do submental, you could also do alveolar nerve. Kind of what he was trying to do, but went straight through the side of the cheek and then squirted the medication outside. Oh, no. The sound of the drill in your head because it's bone on bone. What? Horrible. Went all the way through your skull, basically, and out the back through the chair. Patient's gonna be dead. Definitely talked about the tooth in the string when I reacted to Jackass. On a tooth that's decayed, yeah, I wouldn't do that. Still probably has a deep root in there that is gonna hurt a lot. Look at all the teeth that went flying out. But they all look the same. All teeth are not created equal. The incisors just have one root versus your molars could have 2, 3, or 4 roots. It looks like the whole bottom jaw is gone. For me as an ER doctor, we're looking at it from a stance of like airway management. Typically, if you can get the tongue out of the way, you can see the airway no problem and you can intubate the patient. Oh no, the PTSD guy. Wow. Oh my gosh. Pencils are sharp, dangerous objects. Could you stab somebody in the head with a pencil and fracture through the skull? Probably would break, but you definitely get through the tissue itself. What? Anatomy-wise, the blood vessels for your fingers actually run down either side, and they run with their nerves too. So if you slice on the top, typically you won't bleed as bad as on the side. Run away! Oh my gosh! No! Oh! The cornea is such highly specialized cells and innervated with very sensitive nerves. So that's gonna be so painful. Oh my gosh. Oh my gosh. Somebody like shawarma, I think. Oh, they did a good job relating to like seeing some of the striations of the muscles. Wow. Brings up a good topic of like PTSD. We're getting more and more new therapies out there. People are tormented by their previous experiences of their lives, and it's really hard for other people to relate to those events because it didn't happen to you. We're in the schnoz? Where are we at? So if you fracture a tooth where the piece of the tooth actually comes off, pretty much nothing to do. Even if you have the tooth piece, or if the tooth comes out, you can put it back in as long as it's roughly less than 90 minutes. Get their buddy out. Oh my gosh. They're using the uvula, the little punching bag to lasso it. What? I've never seen a heart explode. I've had issues where the blood is leaking out of the heart and filling up in the sac around it. It's compressing down the heart, which will lead to issues relating to getting oxygen to your tissues and to different organs. Oh no, it's flipping out again, Mr. Flippy. Oh! If you were in an accident and you needed a skin graft where you needed to pull skin from one area and put it on another, you'd probably use either the skin around your butt or your thigh.
So you'd be a butt face.
But you don't go that deep to where you're getting a lot of bleeding. Go! Oh! Obviously, it's going to cause probably most likely bruising, unlikely a fracture, something like that we'd actually worry about. Come on! He ripped off his bottom torso tissue. What we'd actually call that is degloving. Sometimes we see this with people's hands where the skin just rips off, but you're left with all the other functional tissue. What? Don't put it in the dryer. Depends what it's made of. If you use wool, it could shrink. Yeah. Told ya. There's so much elastic tissue within the skin itself. When your skin gets cut or gets ripped off, once it actually doesn't have any more tension, it actually gets really small. He would be bleeding everywhere. There's a couple of drops of blood. Oh no! Oh my gosh! Your intestines are attached by mesentery, so they don't just come off in this long string. So it'd actually just be one big ball of intestines, pretty much. Oh, you can see. Oh my gosh. A lot of times people don't make it to the hospital in these situations. As a pedestrian, please be aware that cars know that you have the right of way, but may not actually see you. Oh, I'm still alive. So call 911, try to get them away from danger. If there's danger, try not to move them too much because more movement can cause worsening damage. Oh, come on. Come on. Depends on the height at which something is falling. Be careful, all you people out there who live in a high rise. Don't drop anything. What the heck is this? Oh, seeing eye dogs. Okay, all right, nice, nice. Dogs have many purposes outside of our companionship. Some dogs can sniff out tumors. Other dogs that know if a seizure is going to happen before it happens. Oh man. The pirate, he's got 2 peg legs and a hook as an arm. So he's got 3 prostheses. We have such good technology nowadays where they're multifunctional. The technology will even get better as time goes on. Oh no! It's gonna start mowing over people. Wow. The skulls come off. You can see brain matter. In real life, when we actually see it, it's mostly grayish white color, really soft, and hopefully nobody ever has to know what it looks like or feels like. Oh my gosh. It feels squishy. Maybe it feels like soft poop. What? Holy cow. The whites of your eyes actually aren't that sensitive to pain, but your cornea is highly sensitive if the nerves are irritated with foreign bodies, scratches, even contact lenses. Gotta be really careful. Protect your eyes. Oh no, it's gonna strangulate. You can see the uvula in the mouth as well as the top of the tongue. The back part of the tongue is a very thick anatomic structure. You guys don't really realize, you only see like the front. Whoa, that's cool. I've seen so many fractured jaws in my career. If they're in good anatomical alignment, your mouth's gonna be wired shut. Sometimes if the bone is destroyed too much, they may need to put a metal plate in there or a pin to keep things together the way that they should. An apple a day keeps the doctor away, but yep, so now you like puree all your food. What the heck? It looks like maybe some sort of eye surgery, but had basically this device that actually opens up your eyelids that goes underneath. They actually use those for different surgeries that an ophthalmologist will actually do. Whoa. Oh. Oh. Nice. What the heck? It's a jawbreaker. Patients will want to escape, want to leave the hospital. Somebody's coming at you with a weapon and they're trying to leave the hospital to call the police. Have I seen somebody's jaw come off and not be there anymore? Yes. In that situation, you want to intubate the patient and stabilize them, get that patient to the operating room. Oh my gosh. This is not good. Man, this PTSD is horrible. Pedestrian hit by a vehicle is a major trauma. Typically, you're going to get CT scan, head, neck, maybe a face. Holy cow. Please tell me somebody knows what movie this scene right here comes from. So I always get this question of like human bites. People have actually come in with tissue that has been ripped and bitten off by another human being on a finger. If you get it specifically even at the joint, you could probably break through it. Intestinal suspenders. Is that baby like covered in poop? Oh, they scalded the baby with hot water. It looks like first-degree burns. You have first-degree, second-degree, third-degree, fourth-degree burn. We get people who come into the emergency department with like toothpaste on it, egg on it, all these weird home remedies. Please don't do it because it's going to cause a lot of pain to get that off. The disposal! Oh my gosh. That is disgusting. Oh my gosh, we got bone coming out. Oh my god, what a good messed up depiction of what the inside of the bone would do. The bones have bone marrow in them, and so there's a blood supply in there. If we can't get an IV in somebody, we'll actually drill an IV into a bone into certain areas. Oh man, right away. So we actually call that open fractures. If it actually goes through the skin, even if it punctures through and then goes back in, that actually needs to go to the operating room and be washed out by an orthopedic surgeon because of the risk of infection. The never ending. Oh my gosh. Oh my gosh. Holy cow. All the time people fall down the stairs. And it's a wide variety of injuries. Sometimes there's ecchymosis, contusion, hematomas, or there's fractures, dislocations, and bleeding internally. What? I wasn't even ready for that. Every show shows intestines like this strip of long, skinny, sausage-looking stuff. It's actually attached by mesentery, a fibrous type tissue that actually keeps it all together in a mix. The moose. Iceberg ahead. It's like old school Titanic, but at least they're a little more advanced notice here. Oh, but of course they have the blind captain leading the way. Right, directed into it. Oh my gosh. Oh my gosh, super cool and interesting and weird all at the same time. People will ask if you can get something to get stabbed all the way through to the other side. Do the ears connect? No, there's a brain in between and lots of bone. Oh, this is a classic example where Dr. Wagner would tell you, don't pull it out. It's into the eye, you've ruptured into the globe. You want to stabilize this, maybe put something around it so it doesn't move, and get to medical care ASAP. No, oh my gosh. The eyes are attached at the ends of what appears to be your optic nerve because you have 6 muscles of the eye which would be attached on each eyeball. Oh my gosh. Typically a fall from standing won't cause that amount of trauma, but it has. It's kind of gross in the sense of they actually are depicting brains coming out. What'd they do? Ah, well, at least that's smart. On the same level of when I mentioned don't pull something out, take the object with you to wherever you need to go. I don't understand why you wouldn't bring the pink bear to a facility that could actually help, but at least they did the first step. Oh. Gross. What is this? What? Look at this smart, cool technology. It reminds me of the old school movie Inner Space. Oh no! This is super cool. Going in the blood vessel, we got red blood cells, we got megakaryocytes, which are like platelets. Oh, making a tourniquet, very cool. Using the fabric is probably better than the belt, and then using a stick to wind it up is actually a good idea. The best tourniquets are ones that you can actually buy that are made to be tourniquets. Oh no, oh no. Oh my gosh, it actually looked like an anus. That's what an anus looks like. He did it so tight that he had his leg fall off. No, it wouldn't happen that way. You would decrease blood flow to that area and potentially cause decreased oxygen to the tissues, and it would actually be very painful. Now what is he doing? Oh, he's looking for him. Oh my gosh. The only thing that we kind of put in the body like that I can think of is something called a capsule endoscopy, where somebody actually swallows a pill that has a camera in it. What the heck? Do not just stab yourself in the abdomen. I wonder where he is. The stomach? He's in the stomach. Oh my god, he's expanding in the wrong place. Oh my gosh. The moose did his own tracheostomy, where he basically shoved the tube in the trachea to allow himself to breathe. Oh. It looks like it could be a hyphema, blood within the anterior chamber of the eye. When people actually come to the hospital with this, you actually have them sit up. I'm sitting up. Because you don't want this blood to get lodged in any weird canals, because then you'll actually increase the pressure of the eye, causing glaucoma. Oh, he's gonna get bigger. I mean, at least we got the two hemispheres. We're always missing the cerebellum. It has to do with the balance center of the brain, as well as the optic nerve. Would you actually die that fast if your body was cut in half? No. If you don't have anybody there to cauterize, stop the bleeding, you're gonna bleed out. And then as you bleed out, you're going to pass out with your heart stopping and no oxygen to the tissues, you're gonna die. Oh my gosh, ingenious, good job, that's super cool. Oh my gosh, buddy brought on the PTSD. So what I always tell you, don't pull them out. You may need to pull them out and risk bleeding out. There are some situations where there's always an exception to the rule. I don't know what kind of amazing cutting rope he just ran into, but both legs are cut. What is he doing? No, that doesn't happen. All the skin and the soft tissue are going to stay intact. It's going to be really hard to rip through that by just spinning it. Oh, don't go to the blind barber. Oh my gosh, took off all his skin. You actually see the striations of the muscles. That's the difference between skeletal muscle and smooth muscle. Just dripping blood. How does he not see what's happening? Don't put aftershave on. Gonna burn. Oh my gosh. Aftershave has alcohol in it. Alcohol burns when you put in open wounds. We don't typically clean the inside of the wound with anything outside of water or normal saline, sometimes even tap water. It just actually has to be under a certain pressure. Ooh. What's happening to his face? Growing on the eyes. Oh my gosh. So if you actually have a cut like that in your eye, it's gonna hurt a lot because the cornea sits over top of that, which has a ton of nerves, so it's gonna cause a lot of discomfort. Oh my gosh, he's got hare's eyes. That's gotta be so painful. Take your time, don't do that, don't do that. Why did I do that? Let me just cut everything, and then I'll just cut my eye too, and now all the aqueous and the vitreous are just gonna fly out of the eye. You're not gonna have any fluid in the eye, the structure of the eye is gonna be gone. And then you're not gonna be able to see, and you're gonna get an infection. Oh my god. What? Why is Giggles in the refrigerator? Whoa! If somebody accidentally overdoses on a certain substance, they actually get what's called the rotatory nystagmus. The eyes actually go in circles. Very, very interesting. So it actually does come from somewhere. Whoa! So you have to be really careful with the metal straws that are out there, because we actually have seen people get injured with those when they fall on them. A lot of times it's usually some oral trauma that occurs, maybe some lacerations or puncture wounds. So just be really careful. What's happening? That is so messed up. Blood doesn't taste good. Blood has a weird metallic taste.
Wow, that is metallic-y.
It's actually nauseating. It's an irritant to the stomach, which the stomach is actually going to react in such a way that's going to make you vomit it out. Yep. What? I always worry about that. Does it take the roof off the car? Does somebody get decapitated? Maybe. Obviously the anatomy is not correct. We don't have blood that squirts through the middle like that. Our major blood vessels in our neck are on the side. Oh. Back in the ambulance. Wait, did he just like cheat death because he's a vampire? No, doesn't happen that way. Typically, the blood is only at a hospital. Sometimes they're at transfusion centers, but they're under kind of lock and key because you want to make sure that you're not giving the wrong blood to somebody. Oh my God. Talk about overindulging. Oh, the sun's coming out. Get out. You can actually get blisters if you're out in the sun. Blister in the sun. And you can develop like second-degree burns, which are blister forming. Not that fast, obviously. We have some bones. We got maybe a little bit of intestines. We got a couple kidneys just laying around. The kidneys actually look like kidney beans. Is that the pelvis bone down there? The skull with the sharp canines. So the canines are the sharp teeth. We all have them. With vampires, they're longer and sharper. In jail. No? In a psychiatric facility. I'm assuming that's a psychiatric facility because of a padded room. They used to have these, but we don't have them here in the United States anymore. What? This actually sometimes happens with people who are going through withdrawals of different substances. This will persist for a few days and then you'll slowly get better, but it's very painful, very uncomfortable. Oh my gosh, holy cow! Wait, against himself? What? The flutes went inside the raccoons, right into their chest, and then the blood is coming out the other end. I mean, pretty good. The question if they went into their airway, which is why the flutes are making noise. Oh my gosh. Sometimes in the emergency department, we'll actually have to use energy to shock somebody out of a rhythm. Sometimes during cardiac arrest or in an abnormal fast rhythm. You know, when you actually get electrocuted and you can't let go, there's something called AC current versus DC current. AC current doesn't allow you to release. It actually contracts your flexor muscles. DC current makes big blast of energy all at once. Oh my gosh, he's multiplied. Holy cow. Oh my gosh. We got knife wounds, we got skin coming off the face. What is happening? No, that doesn't happen. You can't do that, obviously. We talk sometimes about how frail our bodies are. They're not that. We have a cage here that's protecting us. You can't just rip through the cage with your hand and pull somebody's heart out. It doesn't work that way. What? There's so many people that are injured like this. At the hospital, currently, when you come in, we'll label you as like a 1, 2, 3, 4, and 5 as a number based on the amount of resources that you would potentially use at the hospital and basically priority or not. What's happening? You're gonna fall now. Oh man, there could be so many injuries that could occur with this. I've seen the flip side of people putting these bulbs in places they shouldn't be. Oh! So many people come in with like lacerations due to glass and breaking glass, and we'll actually get x-rays before closing the wound to see if there's any pieces of glass within the wounds, because you can't necessarily see them. We'll wash out the wounds, try to clean them all out. Oh my gosh, all stuck in the mouth. That's so dangerous from an airway standpoint. So many lacerations, you can bleed into the back of the throat, difficulty breathing, swelling, airway compromise, very scary. Oh, and then landing on your back and all the shards of glass, awful. First thing I think about when somebody's got puncture wounds to the back like that is a pneumothorax or hemothorax, basically punctured lung. Oh, right through the foot. And if you're wearing shoes, we always worry about Pseudomonas infection, which is a type of bacteria. We'd actually cover you with some antibiotics. And then obviously worry about fracture of the foot. So we're gonna get some x-rays. Oh, don't jump around. Oh gosh. I was thinking it was gonna crash or break. Nope, got a goldfish bowl on your head with the fish swimming around in the water. And now it's an airway compromise. Oh, interesting. People come in all the time freaking out that there's so much blood, say, in your urine. But you have to realize, if you take one drop of your blood and put it in a gallon of water, the whole thing turns into a big, bright vat of red water. But it doesn't mean you lost that amount of blood. Oh gosh. Probably can't breathe now. You can actually have something called a dry drowning versus wet drowning. Basically, it has to do with the spasming of the larynx and your vocal cords. When you get water right in there, it causes a spasm right away. So it blocks it. So that could be why it's dry, where it doesn't actually release it and you're actually almost choking yourself. Oh my gosh, just stop moving. Oh, at least, oh, there we go. Creativity trying to break the bowl, but they're pretty thick glass, like really hard to break. Oh my gosh. More stuff coming off. More glass breaking everywhere. And if you're going that long without being able to breathe, you're gonna pass out. And then as you pass out, if you're still in the same apparatus, you're gonna be hypoxic, decrease oxygenation to your tissue, you're gonna go into cardiac arrest, and you're gonna die. Brain freeze. There's a quick trick. If you actually get brain freeze, you can try to either push your thumb onto the roof of your hard palate. There's some nerves on the top of the roof of the mouth that you can actually warm up to prevent that or to get it to go away fast, or push your tongue against the roof of the mouth as well. Oh, he's like, is he frozen to it? Oh my gosh. You ever see the movie Christmas Story where the kid is double dog dared to put his tongue on the pole? Don't do that. The way to be able to get your skin off of that cold surface, you need a liquid basically, preferably warm. That's probably the fastest, easiest way.
You wouldn't happen to have a cup of warm water, would you?
Wow, it just ripped his face off. You don't really see that too often. Typically, we see lacerations. Lacerations to the face end up healing really well. Now, if there's tissue that is actually ripped off and removed, you may need donor sites to help with that on the face. It just depends on how gaping of a wound it is. These small puncture wounds, if they don't go very deep, you do have to clean them out really well. And trying to clean them out is actually quite difficult because they're holes. Puncture wounds actually have an increased risk of getting infected because they're hard to clean. Okay, hot air balloon. Oh jeez, oh jeez. Oh! It's gonna get some horrible road rash, just burning off the tissue. We see this most commonly in motorcycle accidents. You slide on the ground. If you're not wearing Kevlar pants or leather pants that can have some abrasion resistance, you're just gonna have to get a skin graft. Oh no! Electrical high wires. The biggest thing that we worry about when we see these is when, say, somebody hits into one of these poles and it comes down and it's like a wire that's on a car or whatnot. You don't want to touch the ground and the vehicle at the same time, and you're just going to pass through. What? We got 2 kidneys, we got a heart, the eyeball on top, actually quite funny. Good idea to try to land on a tree to maybe lessen the fall, but that was a big mistake. Oh gosh, don't jump. Oh, zing. Oh my gosh, this is so bad.
Oh, it's so bad.
There's a kidney just hanging out. At least they have the kidney depicted appropriately attached in the middle, where basically all the vessels go into and out of, as well as the ureter. Oh, ripping, wow. Attached to the spine, ripping the vertebral column, so you're having a rupture of all the ligaments that are keeping it attached together. That was intense. There have been issues where people get propeller injuries. Typically, you don't see like big propeller injuries. Either a model plane, smaller things. They've seen pretty bad lacerations and deep wounds where you actually need a subspecialty surgeon to actually put these back together. Oh my gosh, wait a minute. Okay, first off, gotta pick the iron up. You don't want that just sitting there burning. It's gonna burn your clothes. Ah! Gotta get covered. Turn around. So why is he confused? Is there a gas leak in the house? Do you have any example of how you not have an outlet? That's electrical fire hazard right there. Oh my gosh, burning of the face. The burn probably is more likely a first degree, maybe a little bit of a second degree. It just depends on how long it actually stays on there. Oh geez, oh geez. Why is there... Oh, flying at... Come on!
Come on!
Bilateral eye injury into the brain with this probably would not cause that. Probably cause some soft tissue injury. And obviously there's not that much blood going on in our eyes like that. It's mostly more fluid than anything. There's a major blood vessel in the back, but again, wouldn't bleed this much. I mean, it's a funny depiction. It's like soup coming out now. I see a lot of power equipment injuries. The kitchen ones we typically see are fast spinning blades, food processor, or blender, where people stick their hands in when something is caught and they slice off a finger or cause lacerations. But those are... Oh! Wasn't expecting that.
Did not see that coming!
We actually see bite wounds all the time. Human bites, animal bites, both have dirty mouths and both require antibiotic treatment. Typically, it's actually about the same antibiotic. Most of the time, it is a type of penicillin derivative. Oh, there's the finger. Oh my gosh. So what do you do if you chop off a finger by accident? You want to stop the bleeding. You want to find the appendage, maybe wrap it in some wet gauze or something like that. Then maybe put that in a bag. Get ice water and put that in a bag and put the finger inside. So you don't want to directly touching anything that's super cold where it can cause a freezer burn. Let's get it. Oh my. Don't ever squeeze stuff. That is the same thing when, like, say somebody comes in with an eye injury to the hospital. You don't really want to touch the eye because then you can squeeze the goo out. Oh, okay, you get a heart.
You've got your heart.
So at least they depict the heart really well in the sense of like the different attachments. You have multiple different attachments on the top. Usually people depict it as like 4. Oh, we got a kidney. We discussed like organ transplants. There is a time limit and they need to be cooled down. To cool down because you want to slow the processes down. They need to be sterile, clean. You need a recipient to be able to give these to. Oh, needle to the eye, very common. I've seen this many times. And what ends up happening is, depending on how it penetrates, how deep it goes, will cause issues. So if it's just into the globe, it could get infected. You worry about the fluid and the foreign body in there. But then if it messes with your retina in the back, it can cause permanent vision loss. So a lot of different things can occur. It just all depends on where it hits in the eye. Duh. I love how he's like so satisfied and feels much better after he rips out his own eye. Yeah, please don't do that. Killed by your own piggy bank. We get a lot of people that get crush injuries that go to the hospital. Objects fall on an individual or the individual falls from a large height. You just want to examine the whole body because you never know if there's a distracting injury where you're like, oh my gosh, there's blood everywhere for this like ankle, but yet you missed something else. Uh-oh. Oh! Come on. A tray splitting the body in half. Obviously very unlikely, but in this image we're seeing some intestine that's all over the place. Typically the intestines are all attached by mesentery. And then also you're having a good amount of blood here, which is accurate. Push the flight attendant button. Say somebody does get cut in half, right? Let's bring this back to reality. There goes gravity. Is it survivable? It could potentially be, as long as you don't bleed out and die right away. If you can get control of the aorta and the inferior vena cava, which are your 2 major blood vessels, then there's all these other small blood vessels that need to have the bleeding stop. Oh my gosh. No, they're not sleeping.
He's dead tired.
Has anybody been on an airplane where they called for like a medical personnel to help? Let me know in the comments. Oh. Oh my gosh. What creator came up with this? I want to talk to you.
I got a bone to pick with that guy.
You have to be really careful with garbage disposals in your sink or like blenders. If you lose a finger, grab the finger, put it on gauze, and then in a ice cold water type bath, but not directly on ice, and get to the hospital ASAP. You get the rules on the airplane. Don't use your devices. Are there any pilots out there who can weigh in on this? I don't know about this. I know we used to say this in the hospital where you don't use a device that could interfere with our equipment. Typically, it does not. Oh! What? A loose tray just randomly cuts the pilot in pieces, and we see vertebrae, which is actually a kind of good depiction for a cartoon. You have the spinous process on the back. We're missing the transverse processes. You see a cord through the middle, which is red, but typically it's white. Oh, it's like an anthill. Nice. Oh, man. Nice. Wow. Very cool. That is a continuous running stitch where you continually stitch through. We don't use those very often in the emergency department. If I do for a very large wound, I'll actually do a continuous locking running stitch where it actually locks itself. Yep. Oh, man. Oh, no, 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 no. Nail avulsions, where the nail comes off, are painful. They rip off pretty quickly, and they bleed a lot because the nail bed bleeds a lot, and the nail bed itself has a lot of nerves. Oh, it adds some salt to the wound. These ants are mean. Adding salt to any wound can cause it to burn. Obviously, salt helps clean wounds, but that would hurt like heck. Oh my gosh. No, you cannot just rip your arm apart like that. Interesting. Okay, so the arm stayed intact, but the skin came off. This is something called a degloving. So now you see the striations of the muscle. Obviously, there's no fat here, and it's bleeding. So this actually does happen. Very traumatic type injuries cause this. But if you have a lot of the tissue still attached, you can actually then reattach the tissue and the skin. Whoa, house on fire, explosion. Try to put out the fire if you can. Every house should have a fire extinguisher in it. Oh my gosh! Falling from a tree. That is definitely more than 3 times this animal's height. Could cause major injuries. It doesn't mean that there's major injuries every time, but there's a potential for it. Oh my gosh, fire hose. Can't use your hands. Oh my gosh. What? Here in the United States, we have different types of markers related to hazardous materials and flammable materials.
Inflammable means flammable? What a country!
There's different symbols, and you can look them up quite easy. Oh my gosh. If you see somebody in this situation, blankets, clothing, these sorts of things can help smother the fire versus stomping on somebody and causing trauma and more injury. Nice. Oh, wasn't expecting that. Metal wire lacerating the eyeball in half. This is actually quite an emergency because you only got 2 eyes, and obviously if there's a major injury to it, it may not be able to be repaired. Oh jeez. Okay. Flashing lights, somebody's gonna have a seizure. Yep. There it is. If somebody's having a seizure around you, what do? Call 911. Don't try to stop the seizure. If you can, maybe roll them on their side, and actually you want to pad the person's head so they're not banging their head against the ground. Typically, a seizure will last 15 seconds, 30 seconds. Oh. Oh, man.
Oh, man.
Bear traps. They can cause so much trauma, injuries, infections. There's a lot of force. You can fracture a bone, cause lacerations. I've actually never seen somebody come to the emergency department with a bear trap injury. Now that I said that, it's probably going to happen. Oh gosh, he's not gonna be able to do it and snap again. Watch. Knew it. I can write this. Amputation, blood bleeding through the bone, which actually could happen. What the heck do? Grab the piece that's been detached, try to get bleeding control, bulky dressing with a lot of pressure, and get to the hospital ASAP. Don't do that.
Don't do that.
How do I equate this to something that I deal with? Needles that we use at work. I need to put them in the sharps container. Please, don't just be throwing sharp objects around. I would expect the blood to continue to flow because there's not direct pressure to that area that was significantly bleeding like a garden hose. If it's such a clean wound, there is a potential that you can get to a facility that does replantation, basically putting amputated limbs back together.